Hi, my name is Dr. Young Cho, and I'm a board-certified plastic surgeon, and I practice here at Integrated Aesthetics. So as a plastic surgeon, I really value building a relationship with my patients, and this relationship needs to be based on trust. And the way that I like to establish trust with my patients is really to teach them and help them understand what their concerns are, which they're going to be sharing with me. So there's a listening component, but turning that concern into what can I do to help develop the options to address these concerns. And there's a lot of innovation and changes that are going on in aesthetic medicine. There's a lot of options, a lot of confusion out there in the marketplace. I heard about this device or that device. Can Botox help me down here or here? There's a lot of, there's such a need for education on what patients' options are. And I really want to establish that trust so that they feel confident that I can guide them through their own journey. And I think that's going to be a big foundational element on how we work together as a doctor and as a patient, and really take them through that journey. So when you think about making a decision for plastic surgery, you really want to look and do your research. You want to look at standard things that people will say, look at the reviews, look at photos. But when you meet the surgeon and you meet the team, you really want to think about is this the team and the surgeon that I want to go on my journey with? Do they instill confidence? Do you feel like you've established that trust and rapport? Are they going to take care of me afterwards? I have a tremendous number of patients that come to me after their procedure somewhere else because they had inadequate post-procedure care. Whether they've gone out of state, or they've gone out of country, out of the city, or even at another practice here in the city. The follow-up care is just as, if not more important than the actual procedure itself. We pride ourselves in really staying with our patients throughout their post-procedure journey. They're coming to our practice every week for a good month or two. And they're doing things like lymphatic drainage procedures with us, scar management procedures with us. So we stay really closely aligned with you as a patient, and you want to make sure wherever you go that you have that same level of attention. We provide the whole spectrum of aesthetic plastic surgery, whether it's facial surgery, the lids, the brow, lips, nose, ears, lower face, neck. We also do body procedures, so that includes things like tummy tucks, thigh lifts, arm lifts, breast augmentation, breast reduction. So pretty much the whole slew of plastic surgery. We also do more minimally invasive procedures such as fat grafting. We have a body tight device that we use throughout the body as well to provide a more moderate degree of tightening and volume reduction. And I also provide a slew of non-surgical services that complement things that we do surgically, or it can even be used as an alternative depending on what your goals are and how you present. So it's very interesting, my approach to plastic surgery and my patients. Even though I'm a practicing plastic surgeon and I love getting into the operating room and working up a surgical plan and executing on that plan, I like to really think about what are the non-surgical options for my patients as well. It really helps to create a spectrum of options and really helps them to understand what are the trade-offs when I undergo the knife versus when I undergo, let's say, the needle or some other non-surgical approach. And what I've been amazed over the last 10 plus years is that the non-surgical approach continues to innovate at a faster pace than the surgical solutions. And what we can start achieving with non-surgical solutions become more and more impactful with every year that I'm in practice. So I feel like to do a proper service for my patients, I like to really expand on what their options are, help them understand how sometimes we even integrate surgical and non-surgical approaches together, and really come up with the best solution for them. I also have a strong belief that patients understand that it's not a one and done solution, even if it's surgery. We're all on a journey, whether it's an aesthetic journey, whether it's a health journey, whether it's a career. We're on multiple journeys in our lives. And I feel like my role is to be a guide for your aesthetic journey and really help come up with a plan that can help take care of you at different stages of your life and of your journey.